Depression is one of the common mental illnesses. It is often characterized by low mood or extreme sadness and often associated with loss of interest in things that a person previously enjoyed. It is important to note that depression affects other aspects of a person's life, including their functioning and their relationship with others. Depression affects all races of people and across all age groups. In terms of sexes, it is often stated that more women are diagnosed with depression than men. But there are other factors that may account for this. One of them includes the fact that some men are unlikely to report when they start experiencing these symptoms of depression. Aside that, all age groups, children, adults, the elderly, blacks, whites, everybody is affected by depression. Depression affects people all over the world. It's not limited to the Western world, but includes people from Ghana and Africa as well. Like most mental illnesses, there's no single cause of depression. We, however, look at a number of factors. One of them could be the genetic risk, where someone may have a family history of depression and so may be at a higher risk of developing depression. But the fact that have a family history or at risk doesn't necessarily mean you develop depression. And that takes us to the second aspect, which may be the psychological factors. So certain events that happen in our lives, such as abuse, such as losing someone close to you, may also predispose people to developing depression. Another aspect is the social aspect, which is the social support that we get from people, the social environment. If you don't have a very supportive environment, that may also be a negative factor in terms of you developing depressive symptoms. So overall, a number of all these factors must come to play. The genetic risk, the psychological factors, and the social factors all come into play before a person starts showing signs and symptoms of depression. There's a wide range of symptoms and signs when it comes to depression. I'll talk briefly about just a few of them. One important one is the low mood or the extreme sadness. And this sadness is different from our day to day feeling sad one moment and next moment be feeling better. This sadness is usually pervasive and is persistent over a period of time. Aside that, persons with depression may also lose interest in things that they previously enjoyed. So this may include the person going out, talking to friends, the usual things that they do, playing games and all that. Persons may lose interest in these as well. Persons with depression may also start complaining of having low energy. So even after having enough rest, they may still complain that they are still tired. Aside that, persons with depression also start feeling worthless and hopeless. And most of the time, when this helplessness and hopelessness persists, they may start feeling that life is not worth living and may start having thoughts of harming themselves. And some go on to attempt, and eventually, some may be lost through suicide. Aside these ones, other symptoms and signs of depression include sleep and appetite disturbances. So for some people, they may be sleeping a lot more than usual. Other people may also find it difficult sleeping and even wake up earlier, several hours before their normal waking up time. Again, the appetite may also change, with some people losing interest in eating at all, in food at all, whilst others may also end up eating a lot more during this period. Weight changes may also occur in depression, with some people losing weight whilst others gain weight. Some also may become slower at the rate at which they do things or they process information. These are some of the common symptoms and signs of depression. Mostly, it's expected that the person should experience these signs and symptoms for about 2 weeks before they are diagnosed with depression. However, some people may present with symptoms severe enough and you don't have to wait for the 2 weeks. You can still diagnose the depression and put in your management plan as soon as possible. There are lots of measures, again, as for most mental illnesses, that help, but does not necessarily mean that once you have all those or you do all that, you may not get depression. Some people develop depression after doing all this or putting all these preventive measures into place. Some may even develop depression without having any of the risk factors that we discussed. However, a few of the things that can be done to help, which generally improves our mental well-being, include one, getting the needed support. So usually when you're going through difficult times, it's okay to get to talk to someone so you can get the needed support. When you're going through difficult times like bereavement or person who has been abused, it will be important that this person gets to seek professional help to get the needed attention. The support from the society and family is also very essential. It may be important that people may reach out and follow up on people that they think may be having some of these signs and symptoms. Aside that, all general factors like eating healthy, exercising are all helpful in preventing mental illnesses in general, with depression being part of that. Yes, depression can be managed. There are various groups or aspects of the management. One important aspect of the management is the psychological thought therapy. In this, persons with depression are taken through various sessions and are taught various skills that would help them. Another aspect is medications. There are medications that may be helpful for some people with depression, and these medications are taken for periods of time based on assessment of a person, of a doctor seeing the person. In addition, there's a part that is played by all the people around them, which is the social support. It's expected that the people around them provide them support and the needed care as they go through, as they as the illness is being managed. It is important to note that all persons with depression may not need all these three components, but most importantly, the psychological and the social management, and some would also need the medications. Some people with depression get a single episode of depression, and when they are managed, they don't get further episodes. However, there's always the risk that it may occur. Based on the person and how the symptoms play out, some people may need medication for a longer period, whilst others may not need it for that long. For some people, after the first episode, once they receive treatment, they may not need to continue treatment, whilst others who may get subsequent episodes may need medications in the long term to prevent them from getting further episodes. If depression is not treated, a number of things may happen. The symptoms may resolve in some patients, whilst the symptoms may reoccur in others. In another group of people, the symptoms may persist over a period of time. All these may affect the person's output and productivity. The person may not be able to work and support themselves and their families. Some people may also be lost through suicide, as they may have the symptoms severe enough and may be hopeless and attempt suicide. Unfortunately, may be lost through suicide. All these may be consequences of not treating depression. Yes, there is hope for persons diagnosed with depression. Just like other treatments, there are effective treatment options for persons with depression. And with adequate treatment, persons with depression are able to get back to their usual selves and live their lives. It's important that persons who start showing signs and symptoms of depression seek help early so that they can get the needed attention and care. Help for depression and other mental illnesses are currently available in most of our hospitals. For most of our regional and district hospitals, there are designated mental health units that can assist in the management of depression and other mental illnesses. We also have mental health services provided at various private facilities across the country. Again, the psychiatric hospitals are also available to provide support and treatment for persons with depression. There are also NGOs that provide support for persons with depression and other mental illnesses, and you can reach out to them and get the needed care or attention. Families and friends of people diagnosed with depression are their immediate source of support and should be willing and be available to provide this support. Families and friends of persons with depression should not stigmatize against them, rather, should help create awareness, provide them with the support, and even follow up when they are receiving treatment. It is important that they don't attribute their symptoms to being lazy or not wanting to do anything. Rather, they should understand that it's an illness just like any other illness and provide them all the support that they can, just like they do for other illnesses. Workplaces are supposed to support persons with depression in the following ways. First of all, it's important that they identify persons that may start showing signs and symptoms of depression and link them up with appropriate care. There also may be the need for them to adjust the workload or the work schedule of persons with depression during the periods where they are receiving treatment or even when they are returning to work to help them cope and reduce the risk of them re experiencing these symptoms again. Again, workplaces should be mental health friendly and should create awareness about these mental illness among the staff. There should be no stigma against persons with mental illnesses at the workplace, and they should be treated just like we treat other medical conditions in other staff members. Faith and religion may have a positive impact on the management of a number of mental illnesses, including depression. For example, the belief or faith in a higher being may be a source of hope for a person with depression who feels hopeless and may be willing to leave to get the needed care or attention. Again, the support the person gets from the various religious organizations may also aid their recovery. Religion sometimes may have a detrimental effect on persons with depression. For example, in some cases, the depressive symptoms or the depressive illness may be attributed to the moral weakness or the sins that the person may have been committed. This may discourage the person from seeking the needed care and attention that will aid their recovery. Again, in settings where persons going through these problems are chained in facilities, it doesn't aid their care and may worsen their situation. Depression is a common mental illness and affects persons from all walks of life. Some of the common symptoms of depression are low mood, loss of interest in previously pleasurable activities, low energy, sleep and appetite problems, feelings of hopelessness and worthlessness, and suicidal thoughts. It is important to note that there is adequate treatment options available for persons with depression. And with the required treatment, persons with depression are able to get back to their normal lives and live their lives. When depression is not treated, it may have detrimental effects on the person, including the person not being able to get back to their usual levels of functioning or being productive. Care for depression is available at various hospitals across the country, and it's important that we seek care early once we start experiencing or we notice persons experiencing these symptoms of depression. Thank you.